Okay, so welcome to the Step2Skills Industry Insight webinar. Today we are focusing on careers in health and care. We have quite a few speakers from the NHS, different departments within the NHS, and we also have Sarah with us from HCPA, which is a Hertfordshire-based care company. So first up, we have Andy from the NHS who will be talking to us about healthcare science. So Andy, over to you if you're ready.
Hello, I'm just going to share some slides. So my name's Andrew Shaw. I'm the head of radiation protection physics over at East and North Hertfordshire NHS Trust. So I wanted to talk specifically about careers in medical physics, but actually healthcare science in the NHS is much, much bigger. So we've got about 2,000 people who work in medical physics, anything to do with the use of radiation in hospitals, but actually healthcare science employs, I think, 55,000 people in the NHS from roles at kind of level 2 equivalent, so maybe kind of post GCSE A-level level, up to consultant scientists who lead healthcare science services. So I'll go through particularly around medical physics, but I'll try and touch on other areas of healthcare science as well. Let me know if you can't see the slides moving, and I'll change the presentation mode. So I want to just go over the different roles of medical physicists and the different physics departments that we've got in hospitals. So my specialty is in radiation protection and diagnostic radiology physics. We've also got clinical scientists working in radiotherapy, in nuclear medicine, and what we call non-ionizing imaging. So I'm going to go into each of those in a little bit more detail. So my area is radiation protection and diagnostic radiology physics. So the first bit around radiation protection is thinking about the use of radiation in a hospital. So that might be in an X-ray department. So if you've ever gone to have a broken bone X-rayed, we use X-rays and radiation to look for that broken bone. It's useful for patient diagnosis, but it's potentially harmful if you're exposed to it continually. So we've got to think about all the staff and members of the public around those areas and make sure they are safe. So that's one element of what our team would do. But we also then look at patient safety as well. So our team supports 6 NHS trusts through North West London, Hertfordshire, Bedfordshire areas. And across those hospitals, we have something like 1.2 million X-rays happen every year. So that could be right from an X-ray of your little finger up to an interventional procedure in a cardiac cath lab. Very different ranges of exposure to radiation. But what our job is to work with those clinical staff delivering those X-rays to make sure the patients are safe as well, and that we're only using as much radiation as we need to answer whatever the diagnostic question is. Actually, has that person broken their little finger, or can the cardiologist see the coronary artery disease and the vessels around the hearts while they're trying to deliver some therapy? And actually, are we using enough radiation to answer the clinical question, but not too much that we're potentially harming our patients? And again, that's quite a complex role, working in a multidisciplinary area with radiographers, radiologists, cardiologists, lots of other consultant doctors as well. We've got that expertise in understanding the equipment and understanding the risks to our patients, whereas they've got the clinical understanding as actually what do they need to do to make the patients better. So that's one area where we've got medical physics. The next is called radiotherapy physics. So I'm based over at Mount Vernon Cancer Centre in Northwood, but we've got radiotherapy over in Oxford, over in Cambridge, several departments in London. So radiotherapy is used primarily for cancer treatment. So we use very, very high energy radiation or high energy X-rays to target cancerous cells and effectively try to destroy those cancerous cells, but still spare all the healthy tissue around. And the goal is to try and cure the patients if possible, or to at least deliver some palliative care to make the patients' lives a bit more comfortable. Healthcare science staff are involved in ensuring that the delivery of that very, very high energy radiation is extremely precise, and that we've got a lot of confidence in the amount of radiation that's being given to those patients. So we want to give enough that hopefully will cure and be able to treat those patients, but not too much that will actually cause side effects to healthy tissues, or not deliver quite enough radiation that actually we miss the opportunity to maybe treat and destroy those cancerous cells. So there's a huge amount of work there for healthcare scientists in radiotherapy physics, again, in that multidisciplinary environment, to make sure we are treating our patients properly. Nuclear medicine physics. So again, nuclear medicine, it's using ionizing radiation, and there's really 2 areas in nuclear medicine. We might be using nuclear medicine from an imaging test. So we inject drugs into a patient that have radioisotopes. So we've got radiation attached to the drugs that are injected into the patients, and they will go to areas where there might be disease in the patient's body that's useful as a diagnostic test to find out what's wrong with our patients. And again, the use of radioactive substances, injecting them into patients, absolutely needs the role of medical physics. But it's also, nuclear medicine also covers therapies as well. So again, we might be able to inject or administer to a patient a very high dose of radiation, again, attached to a radiopharmaceutical or to attach to a drug that will go directly to where maybe there's a cancer going in within a patient, and we want to concentrate that exposure of ionizing radiation to hopefully treat and cure that patient if we can. And then the final area for medical physics is around imaging with non-ionizing radiation. So we're X-rays, gamma rays, alpha beta particles, they're all types of radiation that can cause harm to patients. We also have radiation that doesn't ionize atoms or molecules, so what we call non-ionizing radiation. So that would be things like ultrasound or MRI scans. And again, we have healthcare science staff working to optimize and make best use of that technology. So MRI scanners are some of the most complex pieces of equipment you'll ever find in a hospital. And medical physicists can work with our doctors, work with our radiographers to make best use of that very complex technology. And that might be around helping to improve image quality and making the images more diagnostic, so helping to find disease or what's wrong with our patients. Or it could be actually how fast we scan our patients. So we know that there's a big waiting list of people waiting for imaging scans. If we can make this equipment work quicker, but actually still produce very good quality images, hopefully will help deal with or address that backlog of patients who are waiting for diagnostic tests. And absolutely, there's a role for medical physicists there as well. But also there's a role around safety, that actually an MRI scanner is basically a huge magnet. So you are not allowed to walk in the room with any iron or steel objects, because that's actually potentially very dangerous to staff working in the room and to patients that might be having their scans. So we've got to think about MRI safety as well as part of the job. In terms of training opportunities, so I wanted to cover three areas primarily today. So healthcare science practitioner training, then the next level up, clinical scientist training, and then actually the level above that as an eventual career endpoint would be consultant clinical scientist training. What I didn't put in here is the kind of entry level, kind of level 2 to level 3 equivalent roles, which actually we have in all of those areas. So perhaps someone who's come through, who's got a couple of GCSEs in relevant sciences, or maybe has done 1 or 2 A levels, that there are roles to basically begin your career in any of those areas that might be a bit more patient facing, but actually that we can then support you with additional training on the job to maybe move up to the next rung around practitioner training. So we've got a few different practitioner training pathways. The goal with a practitioner training is to deliver training that ends up or results in a level 6 qualification or a BSc equivalent at the end of it. So we have got departments where we're taking people straight out of college who might have 1 or 2 science-based A levels, and actually we train them on the job. The employer pays for their university training, and they effectively have day release out to go and do a part-time degree and qualify as a level 6 equivalent healthcare science practitioner at the end of that. And we use those practitioners in all areas of medical physics, and they deliver a lot of the backbone of the work that those departments need to do. So in radiotherapy, it might be delivering quality assurance tests on the linear accelerators, or planning where the treatment beams are going to be delivered for cancer patients. For diagnostic radiology, it might be testing the more straightforward X-ray imaging systems. So our mobile radiographic systems, or our radiography rooms where you might go for your little finger X-ray, we'd get our practitioners to help support the wider team and skill mix, and they would test some of those bits of equipment, and then maybe help the qualified scientists to test things like CT scanners or interventional X-ray ribs. So this is the rough 3-year program. There'd be a project involved, and there's a link there to the apprenticeship website that actually we do use the apprenticeship levy to help pay for some of these academic course fees. And typically we have through IPEM, so the Institute of Physics and Engineering and Medicine is our professional body. They run what they call a technologist training course, which is the same as this really. University of West of England, mainly on Teams, not a lot of face-to-face contacts. There's not a huge amount of travel needed. They also help support this degree apprenticeship, and we're seeing more and more people going on these courses now, which is fantastic, because it's people starting out on their careers in healthcare science, and absolutely essential roles within the NHS. The next level up then we have is the clinical scientist training. So this results in a level 7 equivalent qualification or master's level. So there's two routes really that we go through. So the first is through the National School of Healthcare Science. So this is a 3-year funded program that includes a master's in radiation physics. So you need an undergraduate degree in a science specialism to do this. And then once you've come out the end of it, you are a HCPC registered clinical scientist. The other route that's a complementary route to the STP program is Route 2 equivalence. And actually, I'm a Route 2 trainee, so I trained on the job. I delivered the work that the department needed, but then built a portfolio of evidence that went to the Academy of Healthcare Science. They then independently reviewed that and said, "Yep, you've qualified now as a clinical scientist." And I did that a very, very long time ago, at the start of my career. Once you've been a clinical scientist then for a few years, you're then eligible to apply to the consultant clinical scientist training program. So that's aimed at creating these consultant scientists. So if you think of a consultant, you often think of a consultant doctor, but actually we have consultant scientists as well in the NHS. So that's a 5-year training program that includes a postgraduate diploma from Manchester Business School around leadership in healthcare science, plus a lot of scientific content as well, and then a taught doctorate program. So actually you get to call yourself a doctor at the end of it, as you do kind of a mini PhD. These are some resources. So we've got links to the National School of Healthcare Science, links to IPEM, so the Institute of Physical and Engineering Medicine, and then the Healthcare Science Careers page on the NHS. So I've only talked about medical physics. And again, we've only got about 2,000 people working in those specialisms within the NHS. But there are actually 55,000 healthcare scientists across all the NHS. There are so many healthcare science specialisms. So if you've got any science qualifications or you've got an interest in science, absolutely go and explore those areas. There's lots and lots of content online. That's it from me. Are there any questions? Or do you want to save the questions to the end?
Thank you, Andrew. I'm sorry, I forgot to say before you started that we had the Q&A box. I did put a message in there, so hopefully people saw that. If there are any questions, please feel free to put them in the Q&A box now. If not, Andrew can pop back on at the end and answer any questions if any come up. But really appreciate that, Andrew. It's really good to hear that there are lots of different routes in, that you can kind of do it via the academic route, but also on the job training as well. So thank you, really good. Nothing is coming through at the moment, but maybe if you wouldn't mind just popping back on towards the end of
will do.
the session today, just in case any do come up. But thank you so much. Really insightful. Really appreciate your time. Thank you. Take care. I think next up we have Graham. Is Graham in the room? Graham is in the room. Graham, I think, have you got presenting rights, Graham, if you need to present anything?
I was just going to put one image up, that's all. Shall I give it a go?
Yeah. You should be okay. It looks like you do.
Okay. All right, we'll have a go now. So good morning, everyone. So I'm Graham Duff. I'm Strategic Lead Nurse for Learning Disabilities at Herts County Council. So I'm going to be talking about there's a hand up. Learning disability nursing at the council. Oh, has the hand gone down? Maybe. Okay. Shout out if there's a question. Otherwise, I'll share, or hopefully share. Okay. Can everyone see that?
Excellent. Yes, thank you.
Yeah. Okay. So I'm just going to talk through the structure of the service and some of the things that we do. So, so the Learning Disability Nursing Service works within Hertfordshire County Council, so obviously social care, and we work in adult disability teams. So if you see on the diagram, we've got East, we've got West, and over here we've got 0 to 25. They are community-based teams in which there'll be learning disability nurses, plus social workers, plus occupational therapists. I don't think there's OTs in 0 to 25. And those teams work with people with disabilities, not just learning disabilities. So it would include people with autism who haven't got a learning disability. It would include people with physical disabilities. So there's a slight change there. And the main thrust of what we do is to try and enable people with learning disabilities to access mainstream health services, step in if a specialism is required, and to try and encourage people with learning disabilities to have the same opportunities in healthcare as everybody else. The reason why that's important, for those that don't know, there's something called LEADER, which is a national program that was concerned about the early mortality of people with learning disabilities. What we know is people with learning disabilities die about 20 years younger than on average than the general population. If you come from an ethnic minority community background, at the moment the stats are saying it's an even worse scenario. So that's something we're very much focused on at the moment. So it can be more than 20 years on average. People are dying younger. So part of our role is to try and address that and make sure that people have the same opportunities in healthcare as everybody else. So East and West are community teams with, as I say, nurses, social workers and OTs, apart from 0 to 25. So there's a multidisciplinary team aspect. Referrals can come in from anywhere. You can see the teams are divided up on the right-hand side here across the different patches. I have to say, since this diagram, the East Herts and Broxbourne team are now 2 teams, East Herts and Broxbourne, but they cover across Hertfordshire. And the 0 to 25 service is really a transitional service for the nurses. They work from 18 to 25. So that key period when people are moving from children's services to adult services is really key to get that right, because children's services and adult services are very different. Even the diagnostic criteria can be different. We get all sorts of terminology, learning disabilities, learning difficulties, etc., etc. That can be quite a complicated area in supporting parents for people to move across effectively. Those 3 teams are actually managed by team managers on the social care side, although a number of those team managers are actually nurses. So there is a management role here that nurses can get into, sitting in that joint health and social care arena, which is good, and something I've generally done in my latter half of my career. The bit in the middle, the health liaison team, is the bit that I directly manage. And I have my line manager is head of service for social care. So we do work under, as I say, that under the social care umbrella. And just before I go into what the health liaison team do, our focus is around physical health. There's another part of the story for people with learning disabilities. I don't know if you've got anybody on from HPFT, NHS Trust, but so there'll be learning disabilities working under the NHS Trust, and the focus there will be more around mental health and issues around behaviour for people with learning disabilities. So we work closely with them, but that's not covered here. That will be in the NHS Trust. So just to go through the health liaison team bit, which is the county-wide role, so it's not sitting here or east or west or whatever. So the strategic liaison nurses, so I'm the lead strategic liaison nurse, and there's 2 others. So one is for primary care, is what it says on the tin really. Focuses on the relationships with GPs, primary care, etc. And the other one is for secondary and tertiary care, which the main involvement there would be with the acute trusts, so the Lister Hospital, Watford General, hospitals outside of Hertfordshire that may take Hertfordshire patients, if you like, with a learning disability, and also specialist services, for example, HPFT that I've just been talking about. We have a health improvement and prevention team. I won't just give basic details on these things. Now, the nurses in that team are actually district nurses. They've come to work with us. They built up their expertise around learning disabilities. And the aim of their service is to prevent unnecessary hospital admission into the acute trusts. So they will want to be aware of people with learning disabilities that live in the community, possibly with a social care provider or with families who are at risk of frequent hospital admissions. There are other services in the community that also do this. So one flag for that could be people that have regular and constant admissions, or it could be where a provider comes forward and says, we're struggling to manage this person's health needs. We would need some help around picking up on early signs of ill health, and the nurses will go in and train them so that they can engage quickly and try and prevent that hospital admission. So so the role is very much around using our skills to educate and train and advocate on behalf of people with learning disabilities to get appropriate healthcare in place. Epilepsy specialist services, and that's a county-wide service. Again, that is what does what it says on the tin, really. They work with the medics, and it'll either be consultant psychiatrists in HPFT trust, or with neurology in more general health services, to provide that extra input if individuals' epilepsy is complex. They will get involved with other projects. So recently there was a big project where we had a provider that was moving people on from a large community provider from their services. A large number of people had epilepsy, and the nurses got involved in making sure there was a safe transfer from the community resource to more individually based resources in the community. So that's one thing they might do. They would also make sure people have the right equipment in their homes, like monitoring equipment for epilepsy. They would review medication with the consultants, etc. Acute liaison nurses are based in the acute trusts. We're quite fortunate in Hertfordshire that we have 2 to 3 nurses at Watford and Lister at Stevenage. Not all areas will have that. They'll maybe have 1 nurse. And we have a healthcare assistant plus a band 5 and band 6 nurses. And the role really there is, and we have systems in place for this, to ensure that if somebody is admitted with a learning disability, we're aware of that. We will go and visit the person on the ward and make sure that they are getting, as far as possible, equal access to healthcare. And it can be things that just go off other people's radar. So just to give you one example, we do, not so much now, but we did find do not resuscitate orders were given a bit too frequently for people with learning disabilities without proper consultation with the person and or their relatives and carers, and that would be something that we would engage in to make sure that's thought through and planned properly, using such things as the Mental Capacity Act. So you can see where the advocacy role comes in, is making sure the person's voice is heard. We've got a training lead nurse who does a range of training, just around purely on learning disability, what is it, to more complex training needs, such as the needs of older people with learning disabilities in a social care setting, how to make sure their needs are met. Information quality officer is an admin role. I won't go so much into that here. Purple Star strategy team, I don't know if anyone's come across this. I'll link it with the next one. Creative practitioner and Purple All Stars. So the Purple Star strategy team will work with GP practice, well, any health service really, including those on the high street like Specsavers or in the acute trust, but the focus at the moment is on GPs and primary care, to make sure that they can offer a good service for people with learning disabilities, and they get a Purple Star symbol if they can do that. And our staff will support with training, and we have people with learning disabilities that work for us that will go and do a sort of mystery shopping type exercise with the GP practices, just to make sure that what they say they're going to do, they are doing. We will award a star for that, and support GPs to get to that position. And then the Purple All Stars, we do employ a creative practitioner, are a group of people with learning disabilities who form a drama and music group, and they go out to various functions in the community, supported by our creative practitioner, to deliver appropriate healthcare messages. It might be about, say, losing weight or stop smoking, or during COVID we had a big push on sort of mental health and psychological issues. they will go out and present appropriate healthcare messages through the medium of music and drama, and that can be very, very effective. Very, very popular they are, I have to say. I've mentioned experts by experience, that they are people with learning disabilities who work for us, and will give advice around, again, getting the right information out there to people and in the right format. So one thing they would do is advise on easy read information. So if there is, say, a leaflet providing information on a particular health condition, say diabetes or something, the expert by experience can look at that and make suggestions how to make that information more accessible. Easy read is one way of doing it for people with learning disabilities and potentially their carers. So the information gets across and people can take the decisions they need to in terms of improving their healthcare. And the last bit, health equality nurses. We've got nurses working in 3 areas there. Just quickly before I finish, any questions? One is annual health checks. Everybody with a learning disability should have an annual health check each year. It's a way of preventing problems occurring, so it's a preventative action. So they're going to work with GPs, identify people with learning disabilities on their lists, and make sure an annual health check is done by the GP. We have a cancer screening nurse who makes sure that people with learning disabilities access the 3 main cancer screening programs, so bowel, breast, cervical screening, because if people with learning disabilities perhaps living on their own or with minimal support in the community get a letter invite to screening, they may not understand it. They can quite often be frightened by the word cancer. They won't engage. They'll drop the letter in the rubbish bin. Won't go there, sort of thing. So our nurses will engage with that if people aren't turning up for their screening programs. And then lastly, we have a nurse who works in what's called STOMP, which is the stopping the over medication of people who learn disabilities. So classically, where somebody has been prescribed an antipsychotic medication some time ago and it hasn't been reviewed properly and it's no longer needed, the nurses will get involved with that and look at whether they can reduce or stop that medication, and where that has been possible, it's produced some fantastic results. For example, somebody that has been able to talk hasn't been talking when they've been on that powerful medication. When the medication has been reduced or stopped, they've now started talking again, and it's really enriched their lives. Quick one on training. In the council, we can fund 1 to 2 people per year on the direct 3-year degree program to become a learning disability nurse. We are working on the associate nurse training course, which is the 2-year apprenticeship followed by a 2-year top up to do the learning disabilities bit, because the associate nurse is a generalized nursing course. But we've got to do a bit of work around our skill mix to decide how many associate nurses we want, and that's what we've got to do this year. But we can fund people who work for us. So we have healthcare assistants with us that we can fund through that training, or there's direct entry by the university. And that's all I was going to say. Hopefully that's helpful and what people were hoping for or expecting.
Thank you, Graham. Really appreciate that. I don't have any questions in the Q&A box at the minute, but just a reminder, please put some questions in there if you have any. I had a couple for you, if that's okay. Yep. Now, you mentioned about degree routes in. Now, if someone's studying with Step2Skills currently, the highest level course we offer is a level 2. So they would need, I guess, the next stepping stone after us before a degree, college, etc. What would you suggest they were doing maybe if they went to college to then kind of be ready for these types of roles and the degrees that relate to them? Yeah,
in this area, the course at the moment is only available at the University of Hertfordshire. We're looking to try and change that. It was available at Norwich and in Essex before, so they would need certainly English and maths. The universities would insist on a good standard of English and maths primarily. Yeah, if you're going directly in. And I know you will help with that, won't you?
Yes. So we
Yeah.
offer functional skills, English and maths. I'm just wondering if there's anything that maybe they would do also in addition, rather than going straight then into university, if you thought there was anything.
Not really. I mean, what we do find is quite often nurses, a lot of people don't know much about learning disabilities or even the nursing, and historically people that have come to the service, although we obviously want to change this, are people who've had some prior experience of learning disabilities, but you don't have to have that at all.
Okay.
And one of the things we're trying to do is to go out and speak to people in sixth form and colleges and give more advice around what's involved. But you don't actually need prior experience now. But
excellent.
Yeah.
And also I was interested about your the kind of purple stars and also the experience advisor. Now, again, as well as our courses that we offer for people, we also have employment projects for people, and some of those employment projects, people that come onto them have to have, they're only eligible if they maybe have a disability or learning disability. So something like what you were suggesting there might be interesting for them because they've lived that experience, they have that experience. What would be the route in that scenario?
To maybe work in this field with us, I think I would say at the moment, I don't know how this would work for you. Probably come through to me if you know anybody who might be interested, because there's a range of possibilities.
Okay. We have one of our employment advisors on the webinar today, so I'm just thinking about him and anyone that possibly he might be working with. So Neil, if you're listening, then if you have anyone that you think or any of the other advisors that you think might benefit from this, or it would be an interest to them, then maybe get in contact with Graham directly about potential routes.
Yeah, we can have individualized discussion. Yeah, sorry, Neil.
I might do that if that's right, Graham. Yeah, I think I've seen you quite a bit around actually. Yeah. So I might pop in and have a chat, but I'll send you an email as well if that's all right.
Yeah, I'm there on Thursday.
Great. I might pop in by and see you Thursday. Thanks.
Yeah, okay.
Thank you, Graham. Just checking the Q&A box again. No questions currently, but again, if you have time to pop back on towards the end, then please feel free to do so.
I'm not sure I will, but if you've got anything if you want to email it to me, I can send do it that way.
You. Yeah, right. No worries. Thanks a lot.
Enjoy the rest of the morning.
Really appreciate it. Take care.
Bye.
Nicola, have we got?
Yes, so I've managed to get a colleague to join us. Sasha has kindly agreed to sort of step in.
I'm just going to check. Sasha, have you got permission to share?
I did.
If you need to. There you go. You should now have permission to share.
Fantastic. So, hi everybody. Nice to meet people virtually. I'd just like to point out I have come into this very last minute, so do bear with me. I'm getting over a bit of a viral illness, so my voice is a bit croaky. Can people hear me though? If one person can just say yes.
Yeah, perfect.
Yeah,
Thank
fantastic. So I've sort of come here today to talk a little bit about my journey, which has not been linear at all. It's a bit of a windy route to get where I am now. So I grew up in Hertfordshire, went off to university to do a psychology degree and came out not quite sure what to do with it and needing something to pay my rent. So I worked in finance for a few years, and I actually got back into sort of health and social care through voluntary work. I volunteered in Bristol's Children's Hospital when I was there in the playroom and doing the radio, and going out to the wards and engaging with young people, trying to make their stay sort of a bit more pleasant. And it was through sort of watching the healthcare support workers or healthcare assistants, lots of different names out there, doing their role and watching the nurses. I sort of thought, well, you know, I could do that maybe, not realising quite how challenging the role was. I did want to make sure before completely committing to doing another university course that it was right for me. So I came back to Hertfordshire and worked as a children's community support worker for Hertfordshire Trust, doing night shifts with children in their homes that had things like tracheostomies, gastrostomies, or trophanophs, for example. And sort of really that cemented for me that I did want to be into care, and was ready to undertake my postgraduate diploma in children's nursing that I did at Southbank. And I studied at Great Ormond Street. When I qualified, I then worked at ECLH doing their rotation programme, which was really great. I did the adolescent ward, children's oncology, and the general ward. And having trained at Gosh, that was my first experience of being on the general ward, and I loved it, so I stayed there. Opportunities, sorry, bear with me. Different opportunities came up for me working on a ward. There's always scope to take on extra sort of projects if you're interested in things. I became the student link or the student lead, doing their timetables and working with mentors, as they were known at the time, on the wards, to do their sort of assessments and do the pads. And I had an interest in diabetes, so I was able to sort of do a lot of extra reading, attend courses to become the link for that, and supported newly qualified nurses with looking after diabetic patients. It was really enjoyable. At ECLH, the children's A&E, as it was at the time, was very small, and they did struggle to retain staff. So we had an agreement to provide one staff member every day shift. So I volunteered to be part of the core team that did it. Sort of fell in love with the work that we did in A&E. It really helped build up my confidence, doing the triage in patient assessment. And from there, I had an idea that I'd like to become a children's community nurse. So after a few years, I went off and did that. I enjoyed it very much. The working environment with other staff, unfortunately, was a bit of a challenge. I won't name what that trust was. So that was quite difficult. And I ended up actually going back to UCLH. This was at the beginning of 2020 in their daycare ward. Really great team there. As we were coming into COVID, an opportunity came up for a Band 7 role as a project manager for fit testing of the masks that everyone was wearing at the time. That was sort of a bit of a crash course for me into project management. So what I will say about me personally is I've always been very interested in what I call what goes on behind the curtain. So I'm on the ward and I'm doing all this work, but the corporate offices across the road, what is it that they do to keep us all running? So that was a fixed term contract. It was an introduction to it. I really enjoyed it. I learned a lot. After that, I went back to a nursing role and became an educator at the Excel vaccination centre. So lots of high volumes of people are coming in, and I was responsible in the team for training healthcare professionals, people with a healthcare background, not necessarily registered, to come in and administer the vaccines and how to make it up in the more complex process of Pfizer as it came in. So that was a really good opportunity. But when I was there, another opportunity for a higher band came up again, and it was in project management. At the time, it was fit testing. Fit testing wasn't my passion. It was sort of I'm looking for stepping stones to get where would interest me most and where would utilise my skills and my background. But I did get the job as project manager for fit testing. That was the only substantive contract I've actually had in many years. And unfortunately, when things settled down, that got lost under organisational change, and I was put up for redundancy. So scrabbling around, trying to find another role. I was really interested in the corporate side and the project management side, and was fortunate enough to get a job with Health Education England when they existed. They are now part of NHS England. That was as a programme manager, helping trust project managers to manage the projects that they were given funding for. In my area was rural and coastal in Kent at the time. So that was very much about facilitating conversations, which was very different from presenting and a new skill in itself. So I think for me, having these different opportunities, learning something from them has been really valuable, and it helps open up those doors. After that contract came to an end, I was fortunate enough to get my current role. I am the project manager for the Health and Care Academy with Nikki, our engagement officer, and Kerry-Ann Bantz, who is our lead for apprenticeships, work experience and career progression. So we have received funding for another year. We are funded from NHS England, and our role really is primarily under the train aspect of the long-term workforce plan. And we go out largely to schools and colleges to engage young people, to open their eyes to the possibilities of different careers within health and social care. People have probably heard a lot, like it's over 350 different careers. The opportunities are vast. And what I would say is, if you're looking to do something different from your background, my advice would be take that leap. What people don't realise a lot is you don't need to meet every bit of the essential criteria when applying for jobs. I certainly haven't, but if you've got the transferable skills, then it is definitely worth going for those roles and doing what, challenging yourself and doing what you want to end up doing and gaining more skills. That's what it's about. So I'm very passionate about what we do at the academy. Obviously, corporate role is quite different from my nursing role, but I do use the knowledge that I gained as a nurse as to how things are going on the ward, how the hospital runs from a clinical perspective and how it runs from a corporate perspective. And yeah, it's just been a really circuitous journey to get me where I am now. And I couldn't actually tell you where I'm going to be in 5 years. I'd like to be with the academy for a few more. But yeah, so that's my sort of career story. Does anyone have any questions, or have you all fallen asleep?
No, I think everyone is still in the room. I'm just checking the Q&A. There's nothing there, but I thought it was really interesting what you were saying, Sasha, about the different roles that you've taken on. I think that says quite a lot about transferable skills, and I think they're really important for people to bear in mind, that actually it's not necessarily about the experience you've had, but the transferable skills. For example, if you have been a stay-at-home parent for the last 10 years and you're now trying to get back into a job, all of those transferable skills that you may have gained from multitasking at home and the food prepping and the school runs and all of that stuff. So I think it's really important that people think about transferable skills. And like you say, you don't have to meet all of the criteria to apply for a job, but actually if someone can see that you're passionate and that you have got the transferable skills, that can go a long way as well. But I just thought, whilst you're here and you mentioned about the academy, and I think that's something that not many people know about. I know about it because prior to my role here, I was a careers lead in a school, so I liaised with Nicola quite a lot about the opportunities. But these opportunities, the work experience, etc., the apprenticeships, they're open to everyone, aren't they? They're not just open to young people. So could you maybe just expand a little bit on what that is and how people could go about? Because I think maybe for our learners, for our project participants, that would be a really good stepping stone for what they're between what they're doing now and actually then maybe applying for a role.
Yeah, that's fine. So the Health and Care Academy, we are a people and website resource. We're one of many academies that operates in the east of England. As I said, we get our funding year on year with NHS England, and Maura's keeping our fingers crossed that we get to continue. A big part of our role is, I did say schools because our KPIs are linked to schools, but actually we work with community members and job centres and social enterprise companies that have got funding from elsewhere to try and get people into health and social care careers. It can be a bit daunting. I know that if anyone's looking to get back in, if applying for a job in the NHS, just specific to the NHS, not social care and primary care, you do have to go through the track process. It can be a bit arduous, but I would say stick with it and get support where you can if you want to apply for a new role. In terms of building up your skill set, you can there's a lot of voluntary opportunities out there if you have the time to go and do them. As I said, I'm passionate about voluntary roles because it's what got me into nursing, but I would say look at GoVol Hearts if you maybe want to get a bit more experienced, if you've not been in healthcare before or haven't been in for a while. Other than that, we do offer work experience. It is something that Kerry-Ann is working furiously on to get more and more organisations to join us. We currently have the Princess Alexandra, Eastern North Hearts and Hertfordshire Community Trust advertising opportunities on the portal currently. They can range from half a day to maybe 5 weeks. Everyone is welcome to apply. If you apply and you're unsuccessful, I'd say reach out to the person that's offering it and get some feedback. That's always worth doing because the range of opportunities out there is quite impressive. There's lots of different clinical roles. There's lots of corporate administrative roles. It might be areas you've not really had any contact with, but might have a bit of an interest in. And doing that opportunity, it's good to embrace sort of what that environment is like and get that experience, but also to put on any applications you're making. And at interview, we do a lot of competency-based interviewing in the NHS, and a lot of that is give us an example of something like of when you've demonstrated EDI. They ask EDI questions quite a lot as an example. So I really do say take advantage of the opportunities out there. You have nothing to lose. When you do apply for jobs, certainly one of the reasons my route has been a bit higgledy-piggledy is I've taken opportunities like the fit testing during COVID of the masks. I'm not passionate about fit testing. That for me was a stepping stone to get me into a more relevant job to my background. And I think there are a lot of fixed term contracts out there at the moment, and I would say don't be put off by that because it does give you the opportunity to move around and really build your skill set over time, even though I do appreciate it can be quite stressful when you're coming to the end of a contract, but I would recommend doing that. Another aspect that we've got on our website is just the opportunity to look at all the different careers in health and social care and watch our videos from people that have submitted them talking about their role, what they like about their trust, what they like about their role, and just really have a good old look through our website. Nikki, if you could put the website link in the chat, that would be really helpful. Does anyone have any questions about the Health and Care Academy or anything else I've mentioned?
No, there doesn't appear to be any questions. So I think everyone is just intently listening.
I'd hope so. What I would just say finally is if you see an advert for a job that you're interested in and you don't feel you meet enough of that criteria, you can always reach out to the person that has posted the advert and ask to have a conversation with them. In terms of me, the banding I'm at and the project manager role that I have had phone calls with everyone that I've interviewed for. Like that, it's not to give you the answers or anything, but it can be quite useful to better understand the role and better understand what they're looking for, so you can think about answers to interview questions to try and anticipate what they might ask you. I found that very helpful.
Yeah, agree. Thank you, Sasha. And also just I know you mentioned there about GoVol Hearts. Our next webinar, which is in July, is on volunteering, and it is being run by GoVol Hearts. So yeah, lots of opportunities there as well. So thank you for that. Really appreciate you coming at such short notice. Hope you feel better.
Thank you.
Thanks a lot.
Yeah.
Okay. Yeah, Nicola has put in the Q&A box the links for the Academy website and the links for work experience. So if you are interested, please have a look at those, and I will send them out with the recording for this webinar. So I think, assuming that I'm right, up next we have Sarah, if I'm not mistaken.
Yes, hello.
Brilliant. Thank
bear
you,
with
Sarah.
me. It does seem that the neighbours are getting some building work done all of a sudden. So if you do hear noise in the background, I really do apologise for that. It wasn't there 10 minutes ago and now it's all of a sudden started. Let me just share my screen with you. I do have a video in here. So when it does play, if I just ask if you can hear it, just in case. Oh, actually, bear with me. Let me just. There we go. Right. Perfect. So you can see that screen. Lovely. Yeah. Amazing. So I'm Sarah. I work for HCPA, which stands for Hertfordshire Care Providers Association. I work on part of their recruitment service, which is a not-for-profit to support people to find the right care positions for them in Hertfordshire. So we work with over 700 different adult care providers across Hertfordshire to find them the right people to work for them, and also to find the right jobs for the candidates and put them in a place where they'll thrive, succeed and begin a career within care. So really quickly, what we will cover today is what adult social care is, the different type of care settings that you can work in across Hertfordshire, who receives care and support, what your job may involve day to day, the benefits of working in adult social care and the career progression opportunities that are available, and the different branches you can go off to when you do start your career in care. So just a little bit about my service and what we do. So again, I am part of Hertfordshire Care Providers Association. My service is called Heart's Good Care. And we are a free recruitment service for adult care providers to use to help fill their vacancies. And instead of it being around qualifications and experience, we base it more around people's values, attitudes and willingness to learn, because everything can be taught. It is just a case of finding the right people. So yes, and we also deliver training at HCPA, so we can support candidates who are looking, if they have got a job in care, what kind of qualifications they'll be looking to get to progress into the right area. We can also support with that. So just a little bit about what adult social care is. It's the support provided to adults with physical or learning disabilities or physical or mental illnesses. The support is given to promote independence, safety and well-being. So whether that be older adults or people with learning disabilities, mental health, it is there to support someone to be as independent as possible in every aspect of their life. So the kind of people that receive care and support, there is way more than I'm going to put on this list, but it would take me all day. But it is just worth noting that not one person will fall into one category. Someone might fall into multiple, or someone might not fall into any of these, but still require support. But this is the most that you'd come across working in adult social care across Hertfordshire. So you have older people, people are living longer, so there is more support and care required there. People living with dementia, so I think the stat is now 1 in 14 over the age of 60 develop dementia. So there are homes now that are specifically set up to be dementia friendly, to support people and make them feel as comfortable as possible within that setting. Then you have individuals who have learning disabilities. And again, that is a very umbrella term. There is so many under that. Those receiving end of life care, or palliative care as it's called in adult social care, physical disabilities, mental health conditions and sensory impairments. And the different types of care settings that you can work in. Again, this isn't all of them. There are many more, but these are the most that you'll come across Hertfordshire. So care homes and nursing homes are residential. It's one place of work. You'll have a whole team of care assistants working within that facility, supporting people on a day-to-day basis through the day and night. The only difference between a care home and a nursing home is that a nursing home will have a registered nurse at all times in the facility, as residents may have more complex conditions where a nurse will be required to administer medication. You also have supported living, so this is a bit more independent setting. You can have this for older adults and learning disabilities, mental health. It just means that they'll have support in different areas of their life, but it means that they are independent as well. So it may be that they go to work every day, but they need support when they come home with cooking, prepping meals, paying bills, doing laundry, or it might be that they do need support out at work, but they're fine at home. So it very much is on a case-to-case basis of the person that you're supporting. Domiciliary is support at home. That's something that we're seeing more and more in Hertfordshire now. I always say one of the biggest life stresses is moving house. So for an older adult who has complex conditions, moving from their home that they may have lived in for 30 years, have all these memories, their children being born, grandchildren coming over, then moving into a care facility can be quite detrimental for their health. So we want to kind of stop that as much as possible and have people enjoy living in their own home safely and with the support of care assistants and support workers going in. So that is a service that is offered across Hertfordshire for a care assistant to go in and support someone within their own home and have the ability to live and remain within their own home in a safe way. Then you have live-in care. So that is, as it said, you live in with the resident, normally within their own facility, normally within their own home. You will be there day and night for any support that they need. It's more personalised. You will get to know that person more, the rapport building, and it normally tends to be to keep a couple in a house together. So if it's a husband and wife and they're getting older and both of them require different levels of support, that could mean that they would end up going to different care facilities. So to keep them together, they could have a live-in care assistant come and live with them and provide care for both of them so that they can stay together. Flexi care is very similar to support at home. It's just on a case-of-case basis. A really good example is John. He loves to have a bath every Sunday, but it's unsafe for him to get in and out the bath by himself because of slippery surfaces. So he has a care assistant that just comes in on a Sunday, helps him in and out the bath so he can still enjoy it, but do it safely, and he requires no other level of support. So that's an example of flexi care. And day services. This normally is a 9 till 5 position, Monday to Friday, working with people from different settings who come together to one place. And it may be activities, games, social events happen there. A few day services run bingo, dance classes. They go out to the seaside for the day. So lots of different things. And it's also for residents to get away from their support workers for a little bit, you know, and enjoy other staff members outside of their care facility. So these are kind of the different settings that you could work in across Hertfordshire. And there's lots of different job roles within adult social care. 90% of the job roles we have available are care assistant and support worker. So that is your basic entry level. No qualifications are needed for that level. They'll all be given to you once you've been successful after an interview. You'll be booked onto all the training to feel confident and competent in your role as a support worker or care assistant. But we also do have other jobs available. You know, facilities need catering staff, housekeepers, maintenance, admin, you know, to run as a facility. Also, we've got senior support workers, team leaders, deputy managers, all the way up to your registered managers, your area managers. So it is very extensive, the different opportunities that are available just within adult care and the settings that you would be working in. So just to go through some of the roles, this is a really good video of someone that receives care and support and the type of care that she would like to receive. And it's just really good hearing from a resident and, you know, that it isn't just a job, it is there to support someone and build rapport with them. So let me just play Doris's video. Can we hear that?
Yeah.
Perfect.
They go beyond what they have to do, and everyone's like a member of their family, really. I know I wouldn't be able to cope at home with mum but it takes a lot of pressure off of me.
They always say when they're going, is there anything else we can do for you? Isn't that lovely? I say, no, I'm fine, you know. They do the personal things for you.
They don't just come in and do the job, they go that little bit extra.
Yes.
You know, they're always...
And I think that's what you need.
Because she wanted to be here to sort of, you know, say how lovely they all are and how we couldn't manage without them.
When she comes in, she's always friendly and jolly. She'll shout out to me when she comes through the door. Hi, how are you? I say, I'm fine. Oh, okay then, let's get a cup of tea. You know, you need a bit of fun in your life when you're my age. You don't want miserable people, because you're miserable yourself, you know.
Perfect. I think it is just going to keep playing. Yeah. Okay, so we'll move past this slide because I did talk about the care assistant positions. But yeah, so Doris is someone that we interviewed about her care and support and what she enjoys so much about it. And I think Doris sums it up really well. Absolutely, you are there to do a job, but you are also there to be a friend to this person, to make sure that they are having all their needs met, whether that's socialising, personal care, going out and about, getting jobs done, going to doctor's appointments. You know, someone that you're supporting will rely on you for those things, and it is a really beautiful relationship that you can make with the people that you are supporting. But yeah, so yeah, there's a lovely video. We have lots on YouTube. If you look up our Hearts Good Care YouTube page, we have lots of different videos, but Doris is definitely one of my favourites. So there are lots of different jobs that you can do within care. There is also activity leads or activity coordinators or engagement leads. There's lots of different names for it. But this job is very much preparing and delivering activities for residents within a care setting, making sure that it is inclusive for everyone to be involved. If you've got residents in wheelchairs, making sure anywhere you are going for activities is accessible and they can be involved and engage within the activity. And there is also, of course, people that don't want to be involved in group activities. They'd rather have a one-on-one session, and it's up to the activity coordinator to make sure that that does happen and liaise with the care assistants to make sure everyone's needs are personalised and their care and support is being delivered in a way that they want it, whether that is one-to-one or in a group setting, or they, you know, whether they don't want to go bowling that day because of whatever reason, making sure that they are listened to and their care is given in the correct way. So there are many different other roles that I briefly touched upon. These are just some of them within adult social care to keep a care facility functioning. It isn't always direct care. So if you do have an interest within care, but it might not be that you directly want to support people, there is lots of different positions out there to get involved and support residents without giving that direct care. So the benefits of working in adult social care, this is a study that we sent out to all people working in care across Hertfordshire, and we asked them what the benefits are from them working in care, and these were the most answers that we got from them, that it is an extremely rewarding career, you know, helping others, feeling that appreciation and value from that person you're supporting and also their family members. If you're going in and caring for someone, it normally means that the family do not have the capacity to care for them themselves. So they will really appreciate the support that you're able to give their family member when they can't. Being able to gain new and valuable life skills, which you will take on in your personal life without even knowing. It can support you within a career in care or a career elsewhere if that's what you decide to do. A lot of the skills within care are transferable. It is flexible working hours. Care is 24/7. So if you're flexible with your care provider, the care provider is going to be flexible with you. There is day shifts, evening shifts, night shifts, weekend shifts, whatever works for you. We can normally find that position. Each day is going to be different. You're not going to be sitting in front of a computer every day. You're going to be taking people out and about, doing what they want to do each day. Things change. People want to, you know, human beings are spontaneous. So it definitely will be every day is different, going out and doing different bits and bobs. And care is definitely going to be a career for life. There is always going to be people that need support, and you know, it's a great way to get in and feel that security and stability of having that career, and gaining qualifications while you're learning. So 99% of providers will pay for your qualification whilst you're working with them, and you can do your qualification during your working hours. Obviously, depending on the qualification, the higher it is, the more hours you will need to put into it, and some may be done out of hours, but your level 1, 2 and 3 normally can be done during your working hours with the support of your colleagues and your mentor. And it's also a lot of practical work. When I worked in care, I'm not the most academic person, so being able to do more practical assessments rather than writing essays and doing exams really did work for me, and it made sure that I could get to where I wanted to without having to sit an exam which I knew I wouldn't pass, but being able to show someone how great I can care and the different levels I can do got me that qualification without having to do all the writing. So there's loads of different benefits from working in care. More than happy to have a chat with anyone outside of this if they did have more questions about this. And this is just a brief summary of the different qualifications you can get within care. There is lots of others. This is just a very brief overview of one way that you can go and the type of job that you can get once you've achieved that level. So of course, it goes from level 1 all the way to level 5. Level 1 is entry level. So when if you are successful in a job in care, you will do this qualification in your first week before you start providing any sort of care for anyone, to be able to feel confident within your role. And then your level 2, 3, 4 and 5, you ask your employer and they can get you on that qualification and get you achieving and getting you to those senior positions or wherever you're looking to go to. There is also lots of different other routes you can go into. It doesn't always that you have to remain within care. We deliver a lot of training at HCPA, and a lot of our care trainers have come from working in care because they know it, they've worked it, they're going to know how to train it. So you can become a trainer. You can go into training management, train the trainer, and do your award in education and training, which means you can deliver courses. You can also go down the leadership and management route, which I briefly spoke about. I know this is going on, so I won't play this video. But again, you can go on our YouTube and they will all be there about people's careers in care, how they got there. And again, it wasn't all linear. People have come from different careers. They've been out of work for a while, they've come back in, and within a few years they've managed to work their way up to a manager level. So it is available to people that are interested within adult social care. And then you can also go into further education. So I know that a lot of the I know that Sasha from the NHS has spoken about her career, but from working in care, you can also go into nursing with the NHS. It's a really great transition, and a lot of people that do nursing as degrees, it is asked that they do have some patient fronting experience. So we support a lot of people to get work experience in care. So if you already have that work, if you've worked in care, that's going to be invaluable to then going into the NHS and working with patients. We have had care assistants go into being occupational therapists, social workers, going into midwifery. So it's a really good start to get on that pathway to an NHS career as well. And of course, I know contacts within the NHS. So if anyone does come through to me and they decide the NHS is for them, I can always refer them over to Nikki on the academy. So the options that I can offer people within the adult care sector across Hertfordshire is work experience in any setting I can support with. Mental health is a little bit different, but if it's, I can definitely work with people to see if that's something I can do. But working with older adults, learning disabilities, physical disabilities, sensory impairments, I can definitely support with. I support a lot with schools and colleges getting work experience and placements in college if they're doing health and social care. So more than happy to support with that. I can also support with apprenticeships as well. If someone is interested in an apprenticeship, I can reach out to care facilities and find the right one for you. And of course, we also offer full-time, part-time, 0-hour contracts within care with different care providers across Hertfordshire. It would just be a case of contacting us here at Hearts Good Care, just having an informal chat with us about what you're interested in. It doesn't have to lead to anything. It might just be a chat and you decide it's not for you, or you want to have a little bit of a think and get back to us. But this is our information if you do want to get involved, and we'll be more than happy to support you with any questions, any career advice. If you want a job, we can support you with that, or work experience. Anything you need, please do get in touch. And also you can follow us on social media. But that is me, if there is any questions at all.
Thanks, Sarah. Again, I don't have any questions coming up at the moment. I'm just wondering, are you able to copy that info into the chat for me? And then I can also take it and I can email it out with the recording when I do that later on. But for me, I can really see that there are lots of progression routes, and you can go in at the entry level and you can progress as far as you want to, really. So that was really useful. Thanks a lot.
Perfect. Thank you so much.
Thank you. Yeah, thanks. Got it in the chat. Thanks, Sarah. Really appreciate it.
Thank you. Have a lovely day, everyone.
Thanks. Take care. I think hopefully now, have we got Lynn? Is Lynn in the room? Might not be here yet. Not yet. And have we got Julie? No. Okay, so we are expecting Lynn from the NHS at 11:15. I don't know if everyone wants just a quick comfort break, maybe just a few minutes. If we come back in a few minutes, and hopefully Lynn will be here to talk shortly. If we come back, yeah, in 3 or 4 minutes, and hopefully Lynn will be here. I'll see you all shortly. Thanks a lot. Hi, Nicola. Do we have Lynn yet?
No, I don't think I've emailed them both urgently.
That's fine. I've got Julie. I think Julie's just come in.
Fab.
Hi,
Okay.
Julie.
Morning.
Yeah, let's speak with Julie. And I'll
Julie, are you?
try and
Yeah,
contact Lynn.
Julie, are you okay to present now? We're just
Yes.
waiting for Lynn to join us. So, are you ready to go?
Yeah, that's fine.
Do you
Yeah,
need
no
to
problem.
share any slides, and have you got access to do so?
I do need to share slides. I don't know whether I do actually have access.
I don't think you do, but you will now. Should now have access.
Meeting, record and transcribe meeting information. Which is it normally under? Is it normally under settings?
You should just get an option at the top.
Yeah, it's just not
next to
given.
camera and mic.
Yeah. Oh, yeah. There is there, but it's saying no. It's not highlighted.
Oh, sorry. 1 second. Thought I'd done it. Maybe I haven't. Let's have a look. Okay now?
Yeah.
I just didn't click the confirm button. Sorry. Okay. All right. Over to you. I'll turn my camera off. I'll mute myself. There is a Q&A box for people to ask questions, which we can go through at the end if need be.
Oh, hang on. I've shared too soon. Right. I'm going to share this now. Can you share that? See that?
Perfect. Thank you.
How many people have we got on the call?
There's 13.
Oh, lovely. Okay, and all different backgrounds.
Yeah, so you may have some of our learners or project participants from Step2Skills. We've also got a couple of employment advisors in the room. I think we've also got some other people that work for different parts of Hertfordshire County Council that might be supporting people or just want to know more about the wider roles available. So really, hopefully, if you could give us a bit of info background on your role or the roles within your team and roots in if
sure.
that's okay.
Okay. Well, I put together something, so I'll go through. There's not too many slides. So, okay. So, hi, everybody. Good morning. My name's Julie DeMonte. My current role now is AHP Clinical Education Coordinator at Hertfordshire Community NHS Trust. But my background and what I've spent most of my career doing is working as a physiotherapist. So physiotherapy comes under the title of Allied Health Professional, which you will also hear referred to as AHPs. The Allied Health Professionals are made up of 14 different professions make up this group. The AHP professions that we've got within HCT are physiotherapists, occupational therapists. So I don't know if people generally know about occupational therapy. I think there's a lot of confusion with occupational therapy, but they focus on somebody's function carrying out everyday tasks, and that could be tasks of daily living. It could be washing, it could be dressing. They also get involved in children's therapy as well. And they do a lot of cognition assessments. So assessments when, for example, somebody's had a stroke and they don't think the way that they used to be able to think, or it can be common for somebody having a stroke to lose one sight of their vision. So if they went to complete a clock face, they might only complete half of that clock face, which can have implications on how they can function in life. Speech and language therapists, which, as the name suggests, focus on looking at someone's problems with speech and language, or it could be to do with their swallow. We have dietitians in the trust. We have podiatrists in the trust that focus on foot care and foot assessments with foot problems. And we also have quite a few paramedics in our trust now,
not in the traditional sense of a paramedic being in an ambulance and going out in an emergency, but we have a new hospital at home service where we're trying to keep people out of hospital, and paramedics work with our other AHP team members, and they would go out and see a patient and assess them in their own home, along with their nursing colleagues as well, and see if they can put things in place to help them stay in home while they're under observation as well, through different assessment techniques. There are also another 8 professions under this title as well, but we don't have, well, we do actually have an art therapist in HCT, and that's one of the titles as well. So my career, I went from full-time education, I went straight to university and did a 3-year degree in physiotherapy in Newcastle, which was great. I then stayed in Newcastle and got a job working as a junior physiotherapist, as they were called then. And that was for around 18 months. And that was sort of short rotations. I think they were about 4 months long. And it really gave me the opportunity to look into lots of different areas of physiotherapy. We are quite lucky with physiotherapy that you can have, there's a lot of different areas you can go into. So as well as the, you know, looking at the musculoskeletal side of things, looking at neck problems, back problems, shoulder problems, like you would also see with private physiotherapy. We can also be found on stroke units, we can be found in neurological units, medical wards, surgical wards, gynecology, respiratory care. There are so many different areas that physiotherapists can specialise and can work. So I did all my junior rotations, which really gave me a good grounding for lots of different areas and made me think a bit more about what I wanted to specialise in. I then got a job as a locum for 2 months working in the community in Sheffield. I'd never been to Sheffield in my life. We didn't have sat-navs or phones that had the sat-navs on them at that point. So no Google Maps. So I had an A to Z. I had to find my way around Sheffield, negotiating all the tram lines and find my way to patients' houses. But that was a lovely team, and it was, you know, a great job for a couple of months. I then got a permanent job as a senior 2, which is what they were called then. And it was again rotations, but longer rotations and more in a specialist area. So I was focusing more, I thought I was going to go into neurology. So I started off at one of the big hospitals in Newcastle working in neurosciences. So people who'd had brain injuries, they might have had brain tumours removed. So they'd either had surgery on the brain or they'd had an acute traumatic incident, such as a road traffic accident. So we were treating patients with those problems, looking at how we could rehab them, and also seeing people with things like motor neuron disease, Parkinson's disease. I then moved into the community again, and really felt that that was my passion. I really enjoyed going and seeing people in their own homes. I liked being out and about and not just stuck in a hospital environment. And I liked seeing people in their own homes as well, so you could see firsthand what issues and problems they were having. I then moved to Hertfordshire, and I started, just to find my feet, I started work as a locum and then quite quickly got a permanent position in the community as a senior physiotherapist. And really from there, I worked within those teams and progressed and added further depth to my role, but also leadership, and became a physiotherapy lead for a community team. I did that for a lot of years, and that was a really challenging but really worthwhile role. Had a lovely team with me. But I think the time had come where I'd done a lot of patient care, and an opportunity came up for the role that I'm in now as the AHP Clinical Education Coordinator in the learning and as part of the learning and development team for our trust. And that was really looking at student placements for when people are on courses at university, how we can manage those, how we can support our staff that are teaching students, how we can support apprenticeships and develop them further, and lots of other things that I've seemed to have encompassed in my role. But it's very challenging, really different, and it felt like a really good opportunity to push myself to do something completely different, but still using the skills that I'd gained as a physiotherapist. So what were my key skills? Well, I think I put observation at the top. However, there are blind physiotherapists out there who undoubtedly have amazing skills of being able to use their hands and touch and assess using their hands. But it's really about looking at normal or abnormal movement, and looking at function is one of the key skills, really. And taking in everything, observing the whole area, and carrying out what we call a holistic assessment, which is very much looking at the patient as a whole. So even, for example, somebody comes in with a knee problem. Is the knee problem coming from their ankle? Is it coming from their back? Is it actually a neurological problem that hasn't been diagnosed, and the knee problem is just because of weakness around that area? Is there other things that are affecting it? Is it purely because of something they're doing at work, where they're putting strain on their knee, or doing something getting in and out of their car? So it's very much about looking at the person as a whole and doing a full assessment. Communication is absolutely key. As you could imagine, working anywhere in the health service, I think a lot of complaints are normally due to lack of communication. If patients and their families especially know what is happening and understand what is happening, then they are normally, you can normally get them on board. So that is absolutely crucial in this type of work. But it's also about communication with other members of what we call the MDT, the multidisciplinary team, which could be anybody, any professional involved with treating the patient, such as doctors, nurses, psychologists, therapy assistants, other professionals, anybody involved in their care. It could also be others from voluntary organisations. So as the NHS has been stretched over the years, once we've completed our physiotherapy sessions, we will often turn to the voluntary sector to support with things that are happening in the community, so that the patient feels that they can carry on their journey. So, for example, that could be a referral into a gym at a health centre, or an active ageing class, or something like that. It's also about problem solving, especially in the community setting. In all settings, but especially when you go into someone's home, you can really see the problems firsthand, but also you've got to try and think outside of the box. So you might want them to do a particular exercise because they've come out of hospital. Possibly they're completely bedbound at that point, having been independent before they go into hospital, and they're in a tiny room, and you're thinking, oh my goodness, this is not a gym. How on earth are we going to get you up and moving and doing exercises? And it's really trying to think how you can use everyday objects and the environment and work to move forwards with a patient to try and help them get some function back. Coaching is something we've used more and more. I still, in my role now, do some career coaching for members of staff that request it. There's lots of evidence that show if we can get people to come up with their own solutions, they're more likely to carry them out and move forwards with them. And it's the same with patients as well. So it's a lot about, even when we're setting goals, we're thinking about realistic goals. We want the patient to ideally come up with those goals, because my goal might be to get somebody sitting independently, whereas the patient's goal might be to walk completely independently. But actually, at the level that they're at, that goal of walking might never be achievable, or it might be a long way off. So, it's about using those coaching skills, setting realistic goals with effective communication with the patient. And when I say communication, I'm talking about listening as well as talking, because that's absolutely crucial. We reflect a lot. We're encouraged to reflect, and we often have groups where we do reflective practice. It's a lot about accepting we're not all perfect, and we don't all have the right answers all the time. It's about looking at situations and thinking, would I do this again? How can I do this better? How can I do this differently? Sharing those experiences, because we can come across some quite unique and complicated experiences in healthcare. Leadership skills as well, absolutely crucial. There's a real leadership support within our trust, and we have leaders forums, we have leaders events where we get inspirational speakers, we talk about leadership skills, and that's from the top all the way down, because we're not just expecting our top leaders to have those leadership skills. If they demonstrate them, then it's hoped that it carries on down and we get leadership at all levels. So moving forwards, as I said earlier, I qualified and did a full-time degree. The benefits of that were it allowed me to fully concentrate on my studies, but we didn't have to pay then for our degree courses like we do now, which is just over £9,000 a year, isn't it? So apprenticeships are very much something I'm involved with now, and we are supporting a lot of apprenticeships within HCT. So at the moment we have nursing apprenticeships as well, but from an AHP point of view, we have physio apprenticeships, which started last year. We have occupational therapy apprentices, podiatry apprentices, dietitian apprentice is about to start this year. We have some speech and language therapy apprentices, and we have an art therapist that's just started. Those apprenticeships are really mostly for staff that have been working in a therapy assistant role already. The podiatry apprentices most of those have been recruited externally. And I think as our internal pipeline reduces and we don't have as many therapy assistants that are wanting to move to an apprenticeship, we will start advertising more externally, and that advertising will be done via the normal route on NHS jobs, and you would see an apprentice role advertised. Absolutely crucial to getting onto one of these apprenticeships is normally having a caring background. So often people who go into caring careers either have come from needing caring support themselves, or maybe they've got a family member who's received support from an organisation because of problems they've had in their life, or they've done some work experience. But getting experience, it could be in a care home, could be voluntary work in a hospital. Any type of caring experience will be really good in then getting a therapy assistant role. There are therapy assistants in all the different AHP professions, and if you know that there's nothing to say that you have to stay within a particular profession, so you could work as a therapy assistant within an OT service, and sometimes there is overlap as well, and there are generic therapy assistants who work within teams, and they might do a bit of occupational therapy, a little bit of physio, maybe a little bit of speech and language therapy. All that experience would put you in a good position for applying for an apprenticeship when they become available. And the beauty, of course, with apprenticeships is that you are earning while you're learning. I mean, it is a massive commitment, having to work at least 30 hours a week whilst also studying is a massive commitment, but it does make it financially viable for a lot of people. And it also means that you're able to apply those skills that you're learning at the time. So opportunities for a therapist in an AHP role. So you can starting as a therapy assistant. It could be anywhere between bands 2 and 4, depending on the level of experience you have, but also depending on what the role entails. So there are some band 4 therapy assistants working in, for example, in pulmonary rehab for physiotherapy, who would take classes and help people with their breathing and exercises. There can also be some band 4 roles working in children's therapy as assistants or in the community. It's normally, when you qualify, you would qualify as what's called now a band 5 therapist. And you would normally, that could be now a static role in a team. So if you've been an assistant working in children's therapy, you've done an apprenticeship, your absolute heart and soul is with children's therapy, then you might be able to stay within children's therapy in a static band 5 position. Or you might do a bit more of a rotational post. So again, you're getting experience in different areas. You would then look to progress to becoming a band 6 therapist. And this could be, you could stay as a band 6 for the rest of your career, or there are opportunities within AHP roles to move into different band 7 roles. So whether that's either more of a leadership role or like a team leadership role, or alternative specialist roles. For example, a specialist in pulmonary rehab or a specialist in neurology. There are also options as well for AHPs now, more and more options to apply for other higher leadership roles, such as assistant director in a particular area, strategic lead, those sorts of jobs, project managers within the NHS. So the key points that I would want you to take away are AHP roles are, to me anyway, always interesting, never boring. If you want something that is, constantly inspiring, and it's not the same every day, there's always something challenging and different, then it could be a job for you. It's really rewarding. There's nothing like, seeing somebody bedbound and then being able to walk again, or sometimes it's the smallest things that make a difference to people's lives, and it just makes it very rewarding. And there are also now lots of opportunities, like I've just discussed, to add depth to your career, but also progress as well. Sorry, I've got a really tickly throat. Okay, I'll stop sharing. That's all my slides. I don't know whether you wanted to ask any questions or that's at the end, or...
No, well, I've got one question in the Q&A for you, Julie. I just wanted to say thank you, though. Really clear, really informative, and a really clear way as to which someone can kind of enter and then progress. So really interesting to hear about the apprenticeships that are being offered, which I think, like you say, are a great alternative to a degree, and just getting in on that therapy assistant role first and then taking that step. But there is one question here, a couple actually. So as a second year student, for Bachelor's in Science, Honours for Health and Social Care, what are the channels to start with to be able to become a physiotherapist? So I guess what level would they be maybe going in at, and how would they get in? Would it be the kind of entry level, or because they've got that degree in health and social care, would they be able to go in at a higher level?
So if it's a degree, you're saying it's a degree rather than a level 3?
It looks like it. Second year student for BSc Hons for Health and Social Care.
Yeah, okay. So for physiotherapy particularly, they do want the enough anatomy and physiology background. So, but there are things, so say for example, this person got a job as a therapy assistant in our trust as a physiotherapy assistant. We could then look at top-ups for their education. So top-ups that, currently exist include bridging programs. So Dynamic is an online provider. They do bridging programs, but also University of Essex, they have now just started their own science bridging top-up, which I think is 10 weeks. And there's a cost for that, around £900. And they're hoping to bring that cost down. But that is something if they didn't feel that there was enough anatomy and physiology. So some of the apprenticeships, just having the level 3 qualifications is enough, but some, particularly physiotherapy, want that to make sure there's enough anatomy and physiology. The other thing to add is that sometimes you can get on the full-time MSc Masters Physiotherapy course if you've done a degree already. And that would be a 2-year degree, but that would be financed by yourself.
Okay. And second, I think a lead-on question from the same person, what level of education then is needed for a Band 5 therapist?
So Band 5 therapists normally are qualified health professional, registered with the Health and Care Professionals Council. So you would have a degree. However, there are some teams, so I do know of one Band 5 physiotherapy assistant that has been working in pulmonary rehab, who was working at such a high level that they managed to justify giving him a Band 5 banding. It's not the normal. No.
Okay. And just thinking generally then, if someone's with us learning at Step2Skills, they're on a course with Step2Skills, we don't offer any courses above a level 2. So they might with us do their functional skills, English and maths, and then you mentioned level 3 to be able to get on to the apprenticeship. Would they be able to do a level 3 qualification once in post as a therapy assistant? They'd be able to do that, and then that would then give them the stepping stone for the apprenticeship.
Yes. I mean, things change all the time in the NHS, but at the moment, NHS England is very keen to support these level 3 apprenticeships. So they've actually just released funding for us at the moment. Yes, we are supporting those that want and need to. And actually, we are looking at this moving forwards for all therapy assistants, because in our trust, most of our therapy assistants are working at a Band 4 level. We'd really like them to have the level 3 healthcare apprenticeship as that support worker. It's called healthcare support worker apprenticeship as a minimum, ideally.
Brilliant. Thank you. Really appreciate that. There aren't any other questions in the Q&A box, so I think we've covered everything. Thank you so much for your time. Really appreciate you coming on to talk.
Yeah, no problem at all. Do you want me to did you want me to stay on, or is that all my questions?
You can, I think I'm just going to check with Nicola whether we have got one other speaker. Nicola, have we got anyone else?
No, unfortunately, I've not been able to contact Lynn, so I would assume that she's held up with a patient that she was previously seeing.
Okay, that's fine. No worries. These things happen. So are there, I know a few other speakers have come back on just for the kind of wrap up. So if there's anyone that's on the call that has any questions, please put them in the Q&A box now and I can ask. Don't seem to have anything coming up at the minute. Or if that isn't working, please just raise your hand. We can do it that way as well. I thought I saw something come up, but it's not showing. No, that's just a delay on my Teams, I think. Okay, give everyone a few more seconds. Okay. No, thank you all. Oh, I've got a hand up. I have got a hand up. Just bear with me. Hi, have you got a question? Should be able to speak. I haven't.
Yes.
Hi.
As the question I asked before, because I was told the degree I'm doing is a open, is what they call it, is a general degree. So to be able to do physiotherapy, you need to master it after you finish your 3 years within the university. But let's say during the second year and the third year, where can I get the job as a therapist, as an assistant for therapists? Because I would love to do physiotherapy.
Oh, okay. So to do something whilst you're still studying so that you then have got the experience for when you finish your degree. Julie, is that possible?
We've never found it's particularly worked for people doing a full-time degree and doing a job as well. So the apprenticeships are quite a difficult, it's a big commitment for an apprenticeship, but to do a full-time degree and work is I would imagine quite tricky, but that would be up to the individual to see if there's a job they want to apply for, and discussing that with whoever they get interviewed by if they're successful. I mean, I'm not ruling it out. We do use NHS professionals to use bank workers, but that's normally more qualified staff than it is assistants. The other option would be to look at a hospital and look at doing some voluntary work with maybe one of the big teaching hospitals. They often look for volunteers, but that would give you a good level of experience, and that might be a way in, a door that could open other opportunities to you.
Yeah, I was going to suggest that perhaps looking at the Academy website that was mentioned earlier, seeing if there's any work experience or opportunities, or go Vol Hearts with the volunteering opportunities maybe as well. Hope that answers your question.
Yeah, thank you.
No problem. Well, thank you everyone for joining today. Really appreciate everyone's time. I hope it's been useful. I will email out the recording and some links and extra information once the recording is ready. So thank you so much. Take care.
Thank you.
Bye.